Okay, so this is the first recording of HE lecture number 9, if I'm correct. TLC HE C9 PDF. So, special population. Terms of definitions. A disability is a physical or mental impairment which substantially limits one or more of the major life activities of the individual. It is not an illness or disease, but consequence of illness, injury, congenital anomaly, or genetics. Habilitation includes all activities or interactions that enables an individual with a disability to develop new abilities to achieve his or her maximum potential. Rehabilitation, however, is the learning of previous skills which often requires the adjustment to altered functional abilities and altered lifestyles. The educator's role in assessment of client needs is number one, nature of problem. Number two, short and long term consequences of a disability. Coping mechanisms, the type and extent of deficits, extent of client's knowledge deficits, and client's readiness to learn, and lastly, client's support system. There are two major types of disabilities. Number one is mental and physical. Physical disabilities involve orthopedic, neuromuscular, cardiovascular, and or pulmonary problems. This includes sensory conditions such as blindness or deafness. Mental disabilities, however, are psychological, behavioral, emotional, and cognitive. Those that can affect thinking and involve neuromuscular functioning. 6 categories of disabilities: sensory deficits, learning disabilities, developmental disabilities, mental illness, physical disabilities, and communication disorders. Sensory deficits include problems with the use of one or more of the five senses: auditory, visual, tactile, olfactory, and gustatory. Factors may include infection, trauma, poisoning, congenital, or degeneration. Sensory deficits, an example of which are hearing impairments. These are these affect people of all ages who have either a total or partial hearing loss, deaf or hard of hearing. Three attributes of hearing loss. Number one is the type of hearing loss. There are three types. The degree of hearing loss and configuration of hearing loss. Etiology includes congenital defect, trauma, or disease such as an infection. Deaf, with a lowercase d, is a physical condition of not being able to hear. Deaf, with a capital D, are people affiliated with the deaf community. Communication is a primary source of HCP working with people who are deaf. People with hearing impairment may be unable to speak. Modes of communication to facilitate tactile or whoa, to facilitate teaching and learning. Number one is the American Sign Language or ASL, lip reading, written materials, verbalization by client, sound augmentation such as a hearing aid, and telecommunication devices for the deaf. General guidelines for teaching. Use natural speech patterns and do not over articulate. Use simple sentences. Speak at a moderate pace. Get attention of the client by light touch on arm. Face the client, standing no more than 6 feet away, and ask for permission to eliminate noise. Minimize motions of your head while speaking. Avoid standing in front of bright light which obscure your face. And refrain from placing IV in hand that the client needs for sign language. Another sensory deficit is visual. Visual impairments are some form and degree of visual difficulty, includes partial or total blindness. Legal blindness is a vision of 20 to 200 or less, in the better eye with correction, or if visual field limits in both eyes are within 20 degrees in diameter. Visual impairments are blindness, and visual impairments are caused by many factors. Disease is a major cause of loss of vision in adults. These include cataracts, muscular degeneration, glaucoma, diabetic retinopathy, and tunnel vision. In children, these may be vitamin A deficiency, amblyopia, strabismus, optic nerve neuropathy, prematurity or ROP, LBW, and congenital conditions like cataracts. Examples of which of a sensory deficit individuals are myopia or nearsightedness, hyperopia, farsightedness, astigmatism, distorted vision, presbyopia, loss of ability to focus, and these can be corrected with the use of eyeglasses. Etiology, these include infection, trauma, poisoning, congenital, and degeneration. Factors influencing functionality. Number one is the degree of impairment, and number two, the length of impairment. General guidelines for teaching. So, secure services of a low vision specialist to obtain adaptive optical devices. Avoid the tendency to shout and to use nonverbal cues. Always announce your presence and identify yourself. Allow the patient to touch, handle, and manipulate equipment. Be descriptive in explaining procedures. Use large font size for printed or handwritten materials. Avoid color. Rely on black and white for printed materials. And use alternative instructional tools that stimulate auditory and tactile senses. Learning disabilities are heterogeneous group of disorders of listening, speaking, reading, writing, reasoning, or mathematical abilities. Causes may vary and often unclear. Genetics are 50% of cases. These may also be attributed to pregnancy or the delivery. Common learning disabilities are dyslexia, auditory processing disorder, and dyscalculia. Dyscalculia. Yeah. Dyslexia is a neurodevelopmental learning disorder characterized by slow recognition and inaccurate word recognition. Auditory processing disorder is the used to describe a condition that causes a listening difficulties despite normal or near normal hearing activity. Acuity. 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 Ay. Near or normal hearing acuity. Dyscalculia is the severe disability that impairs those parts of the brain involved in mathematical processing. General teaching strategies for clients with learning disabilities are to eliminate distractions, provide a quiet environment, conduct an individualized assessment to determine how the client learns best, adapt teaching methods and tools to clients' preferred learning style, ask questions of parents about accommodations if needed if the client is a child. Use repetition to reinforce messages. Ask client to repeat or demonstrate what was learned to clear up any possible misconceptions. Use brief but frequent teaching sessions to increase retention and recall information. Encourage clients' active participation. In developmental disabilities, these are represents a lifelong condition resulting from a change in the pattern or nature of a child's development. A developmental delay is a temporary or short term challenge. These are a severe chronic mental or physical state that is present before 22 years of age, is likely to continue indefinitely. Limitations on self care, receptive and expressive language, learning, mobility, self direction, capacity for independent living, and economic self sufficiency. Pervasive developmental DS, a type of developmental disorder with impairment in the socialization and communication skills, examples of which are autism and Rett syndrome. Learning disabilities are examples of learning disabilities are autism, emotional disturbance, hearing and visual impairment, traumatic brain injury, and mental retardation. General teaching strategies are to keep in mind developmental stage do not uh, solely correspond to chronological age. Yeah. Provide concrete examples and explanations. Simplify tasks. Developmental disability or general teaching strategies pa rin pala. Use non-verbal and verbal cues. Be consistent. Use repetition. Encourage active participation and praise positive behaviors and accomplishments. ADHD, also known as Attention Deficit Hyperactivity Disorder. Disability of both children and adults that is characterized by difficulty of focusing on everyday tasks, as demonstrated by inappropriate behavior and being impulsive. This may also be hereditary. Intellectual disabilities are common developmental disabilities, condition that originates before the age of 18 and results in impaired reasoning, learning, and problem solving and adaptive behavior. Asperger's syndrome is a type of pervasive development disability that falls at the high end of the autism spectrum and is characterized by impaired communication, impaired social interaction, and repetitive or restrictive patterns of thought and behavior. Mental illness, advances in mental illness care has varied types of mental illness, mental health to mental illness, and do comprehension assessment, check cognition and inappropriate behavior. General teaching strategies for clients with mental illness are to convey information in a non threatening manner. Teach by using small and brief words. Keep sessions short and frequent. Involve all possible resources. In physical disabilities, these include number one, traumatic brain injury or TBI. Fall, accidents, gunshot wound, blow to the head. Trauma causes changes in behavior, personality, or cognitive ability. It occurs most frequently in adolescent and young adults. Cognitive deficits may include poor attention span, slower processing, confusion, loss of memory, distractibility, impulsiveness, and difficulty with problem solving. Brain injury general teaching strategies include conduct family group sessions, focus on client safety and family coping, give step by step instructions, allow time for responses, provide small amounts of information, and keep sessions short. Memory disorders. Examples are amnesia and brain injury. Alzheimer's disease, multiple sclerosis, Parkinson's, brain tumor, depression are examples of memory disorders. These may be short term memory or long term memory. These may also be a result of a brain injury. Communication disorders, however, are deficits that affect perceptual and or language abilities. Can affect an individual's ability to both send and receive messages. CVA is the most common cause. I don't know what CVA is, but I think you know, so. Aphasia, most common residual deficit of stroke. Impairment of language affecting the production of comprehension of speech and the ability to read or write. Types of aphasia. Global aphasia, both speaking and reception are not present. Expressive aphasia or Broca's area Speaking is not present while reception is present. Receptive aphasia, also known as Wernicke's area, speaking is present while reception is not. And anomic aphasia is temporal. The ability of word finding is not present or is lacking. Parang ganun. Um, Dysarthria is a neuromotor disorder that is caused by damage to the nerves or muscles associated with eating and speaking, including the mouth, tongue, larynx, or vocal cords. General teaching strategies for clients with aphasia is to encourage and praise participation, acknowledge clients' frustrations, keep distractions to a minimum. Speak slowly using a normal tone and short sentences. Have only one person speak at a time. Stand where the client can see your face. Check to be sure that each message is understood. Allow each person time to respond. Ensure a quiet environment. Encourage concentration and intention to improve speech clarity. Ask questions that need only short replies. Use alternative methods of communication. Encourage client to speak slower and louder. Do not simplify message because the client's comprehension is not affected. Chronic illnesses, these are permanent. Affects everyday life, every aspect of life. The social, physical, psychosocial, economic, and spiritual. Successful management is a lifelong process. Development of good learning skills is a matter of survival. The learning process must begin with onset of illness. General teaching strategies for those with chronic illnesses are to acknowledge loss or change in roles, recognize effects of illness on self esteem, emphasize regimens that match physical strength, individualize instruction relevant to problems encountered, encourage integration of new knowledge for problem solving. There are the impacts of chronic illness or disability on family. A. Family role adjustments, and B. Family participation in teaching and learning. That is all. Thank you.